The goals of headache treatment are simple. Have fewer headaches, make them less painful, and avoid needing more or stronger medicine over time. To get there, your healthcare provider needs to know that you are having headaches and needs to work with you on a treatment plan that fits your needs and preferences. This is called patient-centered care and shared decision-making, which means you and your provider make informed choices together. Your healthcare provider should be asking the following questions. They often don't, so know the questions and have the answers ready to clearly describe to your provider. How do you know a headache is starting? How does the pain start? Where is the pain most felt? What other physical symptoms happen? Achiness? Nausea? Weird sight or smell problems? Tingling feelings? What changes in the mood you are in? Or how do you feel emotionally when a headache sets in? How often do the headaches occur in days per month? How long do they last in hours? Does anything you are doing or eating or happening around you trigger a headache? On a scale of 0 to 10, with 0 being no pain and 10 being excruciating, how painful can the headache get? How does having the headache affect your home and work life? Are you under a lot of stress? What medicines and supplements are you taking? How much and how often? Those are a ton of questions, but giving thought to answers and clearly explaining them to your healthcare provider is incredibly valuable. It helps them make an accurate diagnosis about what kind of headache you have and how you can get real relief. Head pain can be caused by a tension headache, sinus headache, cluster headache, migraine, physical problems such as injury, infection, or some other type of imbalance, medications you're taking, stress or another mental health problem, or neurological conditions. Different types of headache pain often have their own tell me more clues. Tension headaches are probably the most common kind. The pain is dull, felt on both sides of the head, and usually mild or moderate. These headaches can happen once in a while, pretty often, or even every day. When they happen a lot, they are called chronic. Most people do not need medical care for tension headaches unless they become chronic. So if they're happening several times a month, it's a good idea to talk with your healthcare provider. Your headaches can be considered chronic and may transform into migraines. The right healthcare professional can help you find better, safer relief than popping acetaminophen or ibuprofen pills like Tic Tacs and risking medication overuse headaches. It's also important to know that migraine is often mistaken for tension headache, and some people who get tension headaches also get migraine. Depending on how often you get headaches and how bad they are, your healthcare provider may suggest medicine to help prevent them. These medicines may include antidepressants or muscle relaxants. Botox injections are also used to help prevent chronic tension headaches or chronic migraine. What can you do for a tension headache? First, learn your triggers. Triggers are things that seem to bring on a headache. Food, weather, and stress can all play a part. In addition to headache pain relief medication, relaxation techniques, counseling, and complementary care can help too. Sinus headaches are not as common as many people think. They're usually caused by a sinus infection. Common symptoms include face pain and pressure, fever, watery eyes, and a stuffy nose. Many people who think they have sinus headaches actually have migraine. In one study, 86% of people who thought they had sinus headaches had migraine. Other studies have found the same thing. Problem is, if you tell your healthcare provider that you have sinus headaches, they often just take your word for it and prescribe an allergy medicine or antibiotic instead of digging deeper. If you think you're having a sinus headache, ask your healthcare provider to examine your nose and throat and go through the Q&A I told you about. You can also ask for a referral to an ear, nose, and throat specialist, also called an otolaryngologist. That specialist can help diagnose or rule out whether your headache is coming from a sinus problem. Cluster headaches are the most painful kinds of headaches you can have. They last from 15 minutes to 3 hours. The pain comes on fast, feels intense, and usually hits one side of the head. Symptoms can include sweating, feeling restless, a stuffy nose, and sensitivity to light. Cluster headaches happen more often in men than women and often start shortly after falling asleep. Cluster headaches can be hard to diagnose. That's why it's so important to describe your symptoms clearly to your healthcare provider. The question list is so important. To stop a cluster headache attack, healthcare providers may use oxygen treatment or medicines called triptans. Triptans are also used for migraine and some other headache types. There are several triptans to choose from. Some are pills, some are nasal sprays or powders, and some are injections. Each one is a little different, so one may work better for you than another. Medication overuse headaches can happen when headache medicine is used too much or too often. Over time, the medicine meant to help may actually make headaches occur more often. Medication overuse headaches are especially common in people who already have frequent migraine or tension headaches. The remedies most likely to cause headaches when overused include acetaminophen, aspirin, and combinations of these products that include caffeine. Triptans are the next most likely to cause more headaches when used too much. NSAIDs like ibuprofen and naproxen can also cause medication overuse headaches, but the risk is lower than with the other medicines I mentioned. How can you tell whether frequent headaches might be caused by the medicine meant to relieve them? Start by asking yourself, how often am I taking this medicine and how much am I taking? And could I be getting a headache after taking it? Your healthcare provider will be asking you similar questions, so it helps to be ready with the answers. Some medicines used for migraine prevention may also help treat medication overuse headache. These include Botox injections and an anti-seizure medicine called topiramate or Topamax. If those options don't help, your provider may try medicines called CGRP inhibitors. CGRP stands for calcitonin gene-related peptide. This is a mouthful, but the idea is simple. CGRP is a necessary chemical in your body that helps send pain signals. CGRP inhibitors block that signal. Most CGRP inhibitors are given as a monthly injection. You may have seen ads for these drugs. These medicines are meant to help prevent headaches over time, but you may still have headache attacks while you're slowly stopping the medicine that was causing the problem. That stretch can be tough. Your provider may prescribe other medicines or special care to help you get through it. Your provider may also refer you to practitioners who can teach relaxation skills or provide cognitive behavioral therapy or another type of counseling. Biofeedback and similar tools may help too. You may also be encouraged to make lifestyle changes such as cutting back on caffeine, getting regular physical activity, eating in a way that supports your health, and getting good quality sleep. Now let's turn to migraine. Are you more than the 37 million people in the United States dealing with migraine? Did you know that migraine is 3 times more common in women than men? Migraine accounts for 1.2 million emergency room visits each year because the pain can be so intense. More than 90% of people who have migraines report not being able to get on with their tasks and plans because of migraine. That means missed work, missed time with family, and missed social events. Here's the most surprising part. Fewer than half of people with migraine talk with a healthcare provider about it. Migraine often causes throbbing pain on one side of the head, but it can sometimes feel more like a tension headache. So how can you tell the difference? With migraine, physical movements often make the pain worse. As the pain builds, nausea or vomiting can happen. Sensitivity to light, sound, and smell is also common. Migraine attacks can last from 4 to 24 hours or longer. Estrogen fluctuations are the cause of migraine in some women. Do you see auras? You may have heard that migraine can come with something called an aura. About 1 in 4 people who get migraine also have auras. An aura is a special sensory experience that happens about an hour before migraine settles in. Visual disturbances are the most common. They may be jagged, zigzagging lines or dots or scintillating, flashing, or flickering lights and blind spots. They can continue for 5 minutes up to an hour. You don't want to be driving when it happens. You just want to find a quiet place to settle in for when the regular migraine hits. Some folks may get ocular migraines. With ocular migraines, some aura symptoms without head pain occur and last for 20 minutes up to an hour. Again, you just want to find a quiet place to settle in and rest while this is occurring. If you suspect you are having ocular migraine symptoms, it's important to note whether you see zigzagging lines, sparkles and blind spots and whatnot in both eyes or just one. If only one eye is affected, get to a healthcare provider as soon as possible. This could be a sign of a more serious problem. Are your migraines episodic or chronic? Occasional migraines or migraines that occur less than 15 days per month are called episodic migraines in doctor speak. Migraines that occur more than 15 days per month for 3 months straight are considered chronic migraines. Your treatment plan will depend on whether you have episodic or chronic migraines, including how severe and frequent your migraines are. If you have mild and frequent migraines, you may be able to manage them with over-the-counter headache remedies and lifestyle changes like avoiding triggers, getting better sleep and nutrition, and working out stressors in your life. If your episodic migraines are more frequent but not frequent enough to be considered chronic and/or your symptoms are moderate to severe, your healthcare provider may recommend a prescription headache medicine and lifestyle changes as we've discussed. If you have chronic migraines, your healthcare provider should prescribe medicine to stop migraines when they occur and also prescribe medicine to help prevent migraines from happening in the first place. When headaches are not treated early and in the right way, they can happen more often and become more severe. Many general healthcare providers make a diagnosis based on the symptoms you describe and then offer a treatment to try. If your migraine or another kind of headache is moderate or severe, it's smart to ask for a referral to a neurologist. A neurologist is a doctor who specializes in health concerns arising from the brain and nervous system. Headache and other pain problems often fit into that category. Some neurologists focus on pain medicine. They may be especially helpful for diagnosing and treating problems like migraine. An acute migraine is a migraine that you are having right now. Acute migraine treatment is treatment you take to stop that migraine. Regular over-the-counter pain relievers such as NSAIDs and acetaminophen may help with mild to moderate migraine. They often work best when taken early before symptoms really dig in. If these medicines don't work for you, or if your migraine attacks are more frequent, more painful or disruptive, your general healthcare provider or a neurologist may prescribe a triptan. Now, there's been a lot of innovation in migraine treatment. New migraine treatments are becoming available that may work better than triptans for some people. Among these is a class of medicines called gepants. Gepants are related to CGRP inhibitors we talked about earlier. You may have seen ads for these medicines. You may have seen ads for transcutaneous electrical nerve stimulation or TENS gadgets for migraine relief. These devices are usually wearable electronic devices that stimulate specific nerves in your head and neck to help interrupt the processes involved in headache. But do they work? It's important to know which ones have FDA approval. Here are some non-drug fixes for migraine. Useful vitamin supplements include magnesium and riboflavin. A useful herbal supplement is feverfew. It's best that you talk to your healthcare provider or pharmacist about proper dosing. Other recommended non-drug interventions include relaxation training, biofeedback, and cognitive behavioral therapy. Now let's talk about what's done to prevent chronic migraine. If you're still having disabling, frequent migraines, even though you are taking a triptan or another recommended treatment, you should ask your neurologist if a medication for migraine prevention is right for you. Preventive treatments can include anti-seizure medications, antidepressants, blood pressure medications, Botox injections, and especially CGRP inhibitors. Also, most of the migraine devices just mentioned are FDA approved, both to help prevent migraine and to treat an acute migraine attack that has already started. Want a more in-depth look into headache and migraine relief? Check out this book on Amazon.com. Remember to like, share, and subscribe.